Welcome to Living Yoga. My name is Darren, and in this podcast and video series, I love to interview people who are smarter than me about all things having to do with yoga and wellness and mindfulness, and hopefully stuff that makes me a better yogi and a better teacher, and hopefully it will for you as well. In this episode, we're going to talk about something that is both very old and very new, and that is transgender yoga students practicing yoga and how we as a yoga community and we as yoga teachers can be more supportive. And the reason I say it's sort of new, obviously transgender people have been around since the dawn of time, but gender affirming care has changed considerably in the last number of years. And so we as yoga teachers and yoga students need to sort of adjust our thinking a little bit. So I have asked Leslie Howard, who I don't know if she put this on her resume, but I think she is the goddess of the pelvic floor. If I have a question about the pelvic floor, Leslie is the person I would go to because she just knows so much. And as luck would have it, she has been learning a tremendous amount about the unique needs of the transgender pelvic floor, especially those people who have undergone gender affirming surgery. So we're going to talk all about that, but a few things up front. First, I know transgender issues are, for some reason, controversial because people love to tell other people what to do with their bodies. You are welcome to disagree with either or both of us, and you're welcome to post those comments in the comment section. But if you post hateful anti-trans things, then I'm going to delete them. So save yourself some time. Again, you don't have to agree, but you do have to be respectful or you get deleted. If you'd like to learn more about Leslie and her work, her website is lesliehowardyoga.com, and I will post a link to that in the notes, along with her other social media and other ways of contacting her. And I will post links to all of my resources and website and whatnot as well. So with all of that out of the way, let's bring in Leslie. Hey, Leslie.
Hi, Darren.
Oh, you froze already. You froze on me for a sec. We're off to a good start. How are you doing?
I'm doing great. Thank you for having me.
I am really excited to chat with you about this, and because it's something that I've, as a yoga teacher, wrestled with myself. Like, I want to be supportive, but I just don't know enough about this emerging issue that I feel like I'm not very supportive at times. And I know that you have wrestled with this yourself, and you've done some research, and I'm curious to hear what you found. But before we dive into like the transgender pelvic floor and how that might be unique, I'm wondering if you could just say, what is the pelvic floor? Because I think a lot of people have heard the word, even yoga teachers, but because it involves our private parts sometimes, we shy away from it and we don't talk about it a lot.
Mm-hmm.
And I think it's an important subject in general for everyone. So maybe we could start by clearing that part up.
Absolutely. Thank you for asking. I love that question. What is the pelvic floor? So the pelvic floor is a set of muscles that is suspended at the bottom of your pelvis. So they connect from pubic bone to tailbone and from sitting bone to sitting bone. And it's a muscle group. And so if you think about the diamond shape of your pubic bone to your sitting bones to your tailbone, that is how the muscles are suspended. And so there's 3 sets of pelvic floor muscles, and 2 of them run from front to back. And then 1 set runs side to side attached to the inner sitting bones. So they are very, very important muscles for so many reasons, because we use them every day for elimination. They're important in sexual wellness. They're important if you're going to have a baby. They're important for your core structure. So, there's a lot of cueing out there to engage your core, but often people don't include the pelvic floor in that because I don't know why. They don't want to say it. But studies show that, if your pelvic floor is engaged at the same time as you're engaging your abdominal muscles, you're like 30% stronger than if you're not thinking about it. So.
Well, when I teach anatomy to yoga teachers, and I'm not the best anatomy teacher, but so I have like this dumbed down sense of anatomy for me. I always say there's two groups of muscles. There's the dating muscles. Those are the ones you go to the gym to work so you can get a date. Like I want nice pecs or nice glutes.
Uh-huh.
And then there's the important ones, the ones that build strength and stability. And I think at the bottom of that important muscle group that most people don't even know they have, like it's a competition between the pelvic floor muscles and the psoas.
Mm-hmm.
I guess the question is, why should I care? If it's,
Well,
I know why I want nice pecs because it's going to get me a
say
date.
that pelvic floor and dating muscles as well. I mean, you could say that. Slightly different.
Touché.
It's different connotation, but why do you care? Well, as we get less young, our pelvic floor gets weaker if we don't pay attention to it. And it's really, really, really important. This is the biggest thing I can tell you is pelvic floor muscles get weak, but they can be weak and short, which is way more common than people think, or weak and lengthened. Okay. So I see people in the yoga community, in the gym community, the working out people, those are people that have a shorter, tighter, weaker pelvic floor. So it's important that we have full range of motion of these muscles. And there's kind of an overemphasis in getting everything kind of tight. And, we think, oh, a tight butt, that's good, or tight abs, and that's good. And just the word tight, like you don't want that. You want tone, but you want range of motion. So, we're a culture of sitters. We've never sat more than we do now. And when you sit a lot, your pelvic floor muscles are in a shortened position. And then they start to learn, oh, I guess I'm supposed to just stay that way. Yeah. So that tucks your pelvis, that like flattens your lumbar, tucks your pelvis, brings your tailbone more forward. And then we go to all these exercise classes or workouts where we're told to tuck and push your back into the floor and suck your stomach in and all those things. And so I would say it's like 80-20, 80% of people that have a weak pelvic floor are tight, too tight.
Yeah. Well, up until recently, and I mean very recently, like in my lifetime for sure, but with even greater, shall I say, frequency, there were just two types of pelvic floors. There was the male body and the female body, and one had a vagina and the other had a penis and testicles and attached to it. And it was pretty simple for us very binary yoga teachers, like as we were talking, and even at that we weren't very good at talking about it.
Right.
But now a certain percentage of people identify as transgender, and an even smaller percentage of people who identify as trans have what's often called bottom surgery, which is having that area surgically changed to reflect their gender identity. Now we have it's different. It's unique. It's neither the of the two. I don't even know how to describe this, but it begs the question, like how I teach pelvic floor work is different between a male body and a female body. And I'm not really sure what to do with somebody who...
Okay. Well, I would like to hear why you do that, but I would say you don't necessarily have to do that. So a couple things I want to say in response to that is, number one, I think it's a really cool fact to know that in utero, up to 9 weeks, we have the same exact genitals. And then depending on if you're an XY or an XX, then they develop differently. So we all start out with the same thing, which is really cool. The other thing is the musculature. The only difference between people with a vagina and people with a penis is that there's an opening for the vaginal canal, right? So that makes people with vaginas, maybe you could say a little less stable, right? But with a body with a penis, the perineum, that space between the anus and the genitals, In bodies with penises, that area is longer. It's about 2 inches long. With people with vaginas, it's 1 inch long. So that, but I would cue things very much the same. So that, I think it's a really great thing that the pelvic floor muscles are very, very similar in all bodies.
Yeah. That's good to know. I think what I would say is that I think, especially women or people, I'm still working on my pronouns, people who have had babies, especially a non-cesarean birth, a traditional non-natural, whatever the proper word is, birth, I think that's a lot to pass through the pelvic floor. So I've heard.
It is, but I also want to dispel the myth that if you've had a baby or 2 or 5 or 10, that your pelvic floor is just getting laxer and more lax, because some people that have babies are traumatized because our birth model in this country is so horrible. But what happens after the baby is vaginally delivered is people tighten up. And so again, you're going back to this shortened, tightened, weakened state of the pelvic floor. And so I just don't want you to think if you had a baby that it stretches you out. It can, but it might not.
Okay. I'm learning so much from you. This is the type of thing like general yoga teacher training or training workshops, unless it's specific to the pelvic core, pelvic claw. That's something that doesn't sound good. Pelvic floor, and unless you've done a workshop with Leslie Howard, I think there's a lot of misconceptions, including ones that I hold. I'm wondering what you found, because any surgery causes scar tissue, and
so
it changes things. So
scar tissue anywhere in the body is tight, hardened, very little, if any, vascularity, meaning blood flow. And so if you have a scar anywhere in your body, after it's healed, after the doctor says it's fine, you should really be going after that scar tissue and trying to break it up and get mobility around that area. Because if you don't, it is literally like a glue ball in that part of your body. So if a way I show it when I'm teaching is I bunch up my shirt, I bunch it and twist it. And you see how it pulls in all directions. Well, that's happening in your skin, in your fascia, in your muscles, and sometimes it adheres to the organ. For example, if you have a C-section and they have to cut your uterus, well, guess what? When you heal, the uterus and the inner lining of your skin and muscle is all going to adhere together unless you get some scar mobilization. So that can wreak havoc. Scars can totally wreak havoc in bodies, and particularly in the pelvic area, because that's one of the more common areas to have scars. And then, of course, with confirmation surgery, there's lots of scarring.
So what, I'm not even sure the right, I guess I'm going to leave this fairly open. Somebody who is transgender, who has had confirmation surgery, what do they need to know in terms of precautions? And what do they need to know in terms of potential benefits of adding, shall we say, pelvic floor informed yoga to their lives?
So I just want to back up a little bit on your question. Is the body that you're seeing in front of you as a yoga teacher, how it looks on the outside may not be the way it looks on the inside. Right. So, people might be binding their breasts. People might be tucking their penis and testicles. Right. So making no assumptions. That's number one. Right. So maybe that they're doing one of those things, but know that if they are doing any of those things, that's reducing blood flow in that area. It's reducing movement in that area. So that is something to be aware of. Okay. So that's number one. Number two, if someone is transitioning, and I'm going to go with, first I'll say, if you're going from a body that was born with a penis to you'd like to have a vagina, you're going to start with estrogen. Okay. And this is where people need to be really careful. People doing it and people teaching people that are doing it, because I'm going to say in very, very general terms that if you were born as a male, you tend to have more muscle mass and bigger bones, right? Generally, that's not an always,
Yeah.
but bigger muscles, bigger bones, stiffer joints, stiffer and tighter ligaments. Okay. Then that body starts taking estrogen and the muscles get smaller. So now you've got smaller muscles over larger bones and stiffer joints and tendons. Okay, so this can be a recipe for injury because the person inside the body has a memory of having stronger muscles. And so they may do something in yoga or exercise or something out in the world where they're thinking they're stronger than they are. And this is where there's some risk of injury. Does that make sense?
Yeah. It makes total sense.
Yeah. So in general, if you're working with a body that's becoming more flexible over a stiffer body, you don't want to let that person go into full range of a pose, for example, like maybe slightly shorter stances in standing poses, or the pose Upavishta Konasana, where you're sitting on the floor with your legs out straight and wide. You don't want to go to your fullest expression of that pose, because you could be straining. If the muscles aren't used to a certain way, you're going to be straining into your joints.
Can I pause you there for a minute? Because I have a follow-up question. This is something that makes total sense to me, but something that I've actually never thought about, which is why we're having this conversation. For me, as well as any other teachers and yogis out there. But frequently, like if somebody comes to my class and they're being treated for whatever, I will ask them, what has their doctor advised them?
Mm-hmm.
Especially if it's something that I don't know much about.
Mm-hmm. Mm-hmm.
Is this information something that their treating physician who's prescribing their estrogen is going to say, be very careful if you're doing stretching because you could overdo it? Or are they just like, here's some estrogen, good luck?
It's a great question, and I honestly don't know the answer. I would say I sure hope so. But the information that you're hearing from me is what I've learned from reading and from talking to pelvic floor physical therapists. And that's a very niche thing, but there's physical therapists, there's a lot of them, and then some of them specialize in the pelvic floor, so it gets a little smaller club. And then there's a couple that specialize in people that are transitioning because of these special things. I'm going to say my experience with doctors in general, like let's say a gynecologist, they don't know as much about the health of the pelvic floor muscles as a pelvic floor PT, because that's not what they're trained in knowing about. It's not that they are not aware of it, but it's not their specialty. They're looking at your cervix, they're looking at your uterus, so they're a little more organ focused. So really pelvic floor PTs, you called me a goddess in my introduction. Thank you. But I also feel like the work of the physical therapists that are doing pelvic floor work is really goddess work. Yeah. God and goddess work.
So what I'm hearing is that there's a good chance that we as yoga teachers or any kind of movement teacher really need to take a little bit of responsibility to educate, to say, if you're taking some estrogen, like just back off a little bit, not give medical advice, of course, but just encourage them to be a bit more mindful, because they may not have heard that somewhere else.
Yes. I mean, I often say to my teachers, that are studying under me around this area, is you might be the first person that's like mentioned some of these things going on, and they're like, it clicks in the yoga class, like, oh my God, the teacher's talking about everything I've got. I've gone to the doctor for this thing, but they don't put two and two together often. So definitely I think yoga teacher as like a referral, like, a general information, hey, you might want to think about this. And if I could just finish up on the transition, like
Please.
if you're going from a female to male body, so now you're reducing estrogen. Okay, so now if I'm going to again speak generalities, but if you're born a woman, you tend to have smaller bones, less muscle mass, more flexibility in your joints, and less tension in ligaments and tendons. Okay, so you start reducing your estrogen and upping your testosterone. And then what's going to happen is you're putting on more muscle mass, but you're putting it around a smaller bone and a looser joint. Okay, so now you have more power and you're feeling more power, right? But in your mind, you might remember how flexible your muscles were, but the testosterone is making you less flexible. And then you're going again into a danger zone of too much range of motion. Does that make sense?
Yeah.
Yeah. So these are things, again, if you're a yoga teacher and you know what your student might be going through, these are things to think about. So you don't want to push people in the strength department that are transitioning with testosterone because they might injure themselves thinking they're stronger than they actually are.
Yeah. Is there anything, I noticed you haven't touched on anything surgical yet. Is that something you want to touch on?
Right. Yeah. Okay.
Which is fine, but I have a follow-up question that is more
general. No, I had to back up before I
encompass all of it.
I forgot about it.
So if you want to touch on that, and then I have a follow-up question that I think ties into all
so,
all right.
So that's hormones. That's the effect of hormones on the body. So you have to think about the hormones are scaffolding over a different structure. So you need to think about that. You might be putting a looser scaffold on a tighter body or vice versa, right? So, okay, then you go for gender confirmation surgery. And then what that's adding is scar tissue, which we talked a little bit about, but scar tissue in the pelvic floor area. And so that is going to create, again, more tension, more tightness. So if you were born with a penis, you have more probability of tending towards a tight pelvic floor. Whereas if you were born with a vagina, because again of the vaginal opening, well, I like to say you might have less stability because you have an extra opening, right? That doesn't necessarily mean looseness, but less stability. Okay, so then if you're going for the surgery, the scar tissue is just adding more tension. So again, it's really important, and this is where the pelvic floor PT could come in handy. Not that you have to depend on them to do it, but maybe to even just show you to do it. And if you don't have the medical coverage or whatever, you can there's probably a ton of YouTube videos on scar mobilization. Scars anywhere on the body, you need to mobilize them, okay? So there's probably not YouTube videos for pelvic floor scar mobilization just because of the area of the body. But same idea is that you want to massage it, you want to pick it up, you want to pinch it, you want to move it. You're trying to get mobility in those tissues so that you have better blood flow. And we all know that if you want to have a good sex life, that better blood flow into the genitals is really crucial.
Which comes to the whole point of this conversation, how I can improve my sex life. Why I secretly, my ulterior motive.
I see. Okay, now I know.
So I have this is more like a less scientific, more sort of like a holding space as a teacher question. And also, I think from the student angle as well. I find that any talk of the pelvic floor, you're treading into potentially uncomfortable territory.
Correct.
For instance, if I, as a male teacher, stand in front of a room full of predominantly female students and I say, we're going to talk about your vagina now, that could feel awkward for me. Not really for me, because I don't feel awkward. But I'm very mindful that it could make some of my students feel uncomfortable, even if my intentions are completely noble.
Right.
And then you add in that added layer of something that is relatively new in terms of the common knowledge, and different people are at different places in their transition. Like if
Yeah.
somebody is still in the closet and just wrestling with that internal aspect of being transgender,
Right.
it just makes it a really difficult
Yeah.
subject. That doesn't mean we shouldn't address it. It just, I'm wondering if you have advice for how teachers can hold space for that, and
Well,
how students could maybe approach a teacher or suss out, is this the right teacher for me to
mhm,
have a conversation so I can get the best guidance possible?
mhm. Okay,
Does that make
I
sense?
yeah, it does. I generally don't say vagina, penis. I just generally don't say that in a general class, okay, because of the triggering effect of that you're
Yeah.
alluding to. If it's a pelvic floor class, like I might be giving a pelvic floor workshop where it's a general information workshop. I might be giving a pelvic floor workshop for incontinence or pelvic pain, things like that. Then I'm going to, like, at the beginning say, hey, I'm going to use this terminology. And then I try not to say your vagina, I say the vagina, right? I try not to genderize anatomy, and I try not to say your, I say the. And so just, so it's like a more general statement than rather people don't have to take it in so much, right? So there's that. Um, and then to speak about how could you speak about the pelvic floor in a way that's not triggering, you could speak about it in bigger brush strokes. Okay, so you could say, we're going to do stability work today, and a big part of the stability work is the pelvic floor. If you're not familiar with the pelvic floor, it sits between your pubic bone, your tailbone, and your sitting bones. So I'm going to be cueing you what to do with your sitting bones, or I'm going to be cueing you what to do with your tailbone. So for example, if you can imagine the pose warrior number 2, where you're in a lateral standing pose, the feet are wide, the legs should go externally, or hips should go into external rotation, right? When the thigh bones go into external rotation, the sitting bones come towards each other. So the muscle that sits between the two sitting bones as part of the pelvic floor shortens. So you can cue just from the body parts of sitting bones, tailbone, pubic bone. Okay, is that helpful at all?
Yeah.
Yeah. And then also, I also say in my general classes, perineum. So lift your perineum, or widen your perineum, or allow it to lift, or allow it to descend, because I feel like that's a very, again, non-gendered word.
Yeah.
Yeah.
Well, of course, this conversation, like all great conversations, brings up more questions than it provides answers. But that was part of my goal with having this conversation, because I think this stuff we'll all be learning for years to come.
Mm-hmm. For sure.
But I do think having this conversation, as more and more of our students identify as transgender, they're considering their options in terms of affirming care, and the result of that is changing bodies that need, yoga is about meeting your body where it's at. And
Right. Right.
so I'm really, really grateful for this. And I learned like 10 things. I'm going to write all this down as soon as we get off. But I would like to, inevitably, there's somebody watching or listening to this that would like to learn more, either for personal use.
Mm-hmm.
It could be somebody who is cisgendered, or somebody who's transgender, or somebody who's not sure. But you triggered something in a good way in their mind, in their heart, and they might want to learn more. How, aside from they can go to your website, what types of things do you offer in terms of trainings, in terms of classes? Do you have an online offering? Because some people watching this
Yeah.
or listening
So
might not be near you.
Thank you for asking that. Okay, so I have a book that I wrote in 2017, but I did write it more for people with vaginas. So I'll just say that. I would like to do a new edition. That's on my to-do list. I have an online pre-recorded 20-hour training for yoga teachers, interested students, massage therapists on pelvic floor issues. Definitely there's a module in there for I call it the transitioning pelvis. And it's not just transgender, because I was going to say you can also throw pregnancy into a lot of the things I said, right? So a pregnant person, all of a sudden they have a memory of themselves one way, and they're getting all of this hormone called relaxin, and their body's a lot looser than they're used to. So high possibility of injury in the transitioning pelvis, in that direction. Okay. If you prefer live trainings, I also do probably 2 a year live, either on Zoom or in person. The next one I have scheduled in person is in Washington, D.C. In the fall. And then you can look at my website. I often do like a 3-part workshop, either for incontinence issues or pelvic pain. I teach them slightly differently. Yeah. So.
Well, I just want to say I have been a huge fan of yours for a very long time. I love the work you're doing, and I hope people, for whatever reason, who feel inspired by this conversation will seek you out, because you have so much to share. And I would love to have you back on to talk about other things having to do with the pelvic floor. But or maybe a follow-up as more and more research is done, or you learn more.
Yeah.
But definitely check out Leslie's website. I will put a link to it in the notes associated with this show, and I will also put links to her website, social media, and other resources, as well as how you can reach me and learn more about my work. And if you have comments or questions, we will keep an eye on those. So feel free to post those things in the comment section. But just again, I cannot stress this enough. I don't allow hate speech on anything I post. You can send me hateful emails all day long, but I won't be posting it. So share your own experience and whatever you'd like, or your own opinions for that matter, but just keep it civil and respectful. Leslie, you are incredible, and I cannot wait to see you in passing at the yoga studio.
Thank you.
And maybe to do another interview like this.
Yeah, well, I just want to say thank you for giving this issue a voice, because I don't think it's not general information that's taught in a yoga teacher training, for sure, and it should be.
Yeah, well, I think it's evidenced by some of my questions. Like, I've been around for a long time, and I do know what the pelvic floor is, and I'm pretty comfortable with it. And I still learned so much just talking to you today, and even the phrasing stuff and understanding stuff. I've been a strong advocate of transgender rights and creating space in the yoga world for people who are trans and non-binary, and that I'm so ignorant of so many things, and so
there's a lot of things.
It's okay to be ignorant as long as you seek out better and better information all the time.
Yes.
So thank you for doing that for me.
Yeah. Thank you for your work as well.
Thanks. I will see you very soon.